Piracetam is a nootropic cyclic GABA derivative used in Myoclonus, sickle cell disease, alcohol dependence, and as a general cognitive enhancer. In this video, let's found. What is piracetam? What class of drug is piracetam? What is piracetam used to treat? Who cannot use piracetam? What are the side effects of taking piracetam? How does piracetam make you feel? How to use piracetam? What is piracetam? What class of drug is piracetam? Piracetam is a drug marketed as a treatment for myoclonus. It is also used as a cognitive enhancer to improve memory, attention, and learning. Evidence to support its use is unclear, with some studies showing modest benefits in specific populations and others showing minimal or no benefit. What is piracetam used to treat? Indicated in adult patients suffering from myoclonus of cortical origin, irrespective of etiology, and should be used in combination with other anti-myoclonic therapies. Who cannot use piracetam? Piracetam is contraindicated in patients with severe renal impairment, renal creatinine clearance of less than 20 ml per minute. It is also contraindicated in patients with cerebral hemorrhage and in patients suffering from Huntington's chorea. Who cannot use piracetam? Piracetam is contraindicated in patients with severe renal impairment, renal creatinine clearance of less than 20 ml per minute. It is also contraindicated in patients with cerebral hemorrhage and in patients suffering from Huntington's chorea. What are the side effects of taking piracetam? Some people may experience adverse effects, including depression, agitation, tiredness, dizziness, insomnia, anxiety, headaches, nausea, paranoia, and diarrhea. How does piracetam work? Piracetam interacts with the polar heads in the phospholipids membrane, and the resulting mobile drug-lipid complexes are thought to reorganize the lipids and influence membrane function and fluidity. Such interaction has been reported in a study that investigated the effects of neuronal outgrowth induced by beta-peptides, while amyloid peptides cause lipid disorganization within the cell membranes leading to neuronal death. Piracetam demonstrated to decrease the destabilizing effects of amyloid peptide. The authors suggest that piracetam induces a positive curvature of the membrane by occupying the polar groups in the phospholipids to counteract negative curvature induced by amyloid peptides, which in turn would decrease the likelihood of membrane fusion. This mechanism of action is thought to improve membrane stability, allowing the membrane and transmembrane proteins to maintain and recover the three-dimensional structure or folding for normal function such as membrane transport, chemical stimulation, and receptor binding and stimulation. Through restored membrane fluidity, piracetam promotes restored neurotransmission such as glutamatergic and cholinergic systems, enhances neuroplasticity, and mediates neuroprotective and anticonvulsant effects at the neuronal level. It is also demonstrated that piracetam also improves the fluidity of platelet membranes. At the vascular level, piracetam decreases adhesion of erythrocytes to the cell wall and reduces vasospasm, which in turn improves microcirculation, including cerebral and renal blood flow. Half-life. The plasma half-life of piracetam is approximately 5 hours following oral or intravenous administration. The half-life in the cerebrospinal fluid was 8.5 hours. How to use piracetam? Suggested dosing. Adult, 1.6 to 9.6 g/day orally. Are there specific concerns about piracetam and pregnancy? Piracetam crosses the placental barrier. Drug levels in the newborn are approximately 70% to 90% of maternal levels. Piracetam should not be used during pregnancy unless clearly necessary, when benefit exceeds the risks and the clinical condition of the pregnant mother requires treatment with piracetam. That's all the information about piracetam we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.